Namaskar. You're watching Dr. KK Med Talks Fridays with Dr. Anita Kant non-stop show 1085th episode. Let's have the headlines of the day. Recent studies show the incidence of early onset cancer diagnosed in adults under 50 is increasing, with cervical cancer ranked as the second most common cancer in the world. WHO has set a global target to eliminate cervical cancer as a public health problem by 2030. The strategy focuses on vaccinating 90% of girls with preventive vaccines, screening 70% of women with high performance tests, and treating 90% of women with cervical cancer or precancerous cells in the cervix by 2030. Apollo Cancer Centers and Cure Foundation launches free cervical cancer vaccination drive to mark World Cancer Day. Karnataka launches targeted initiative to eliminate cervical cancer, offering free HPV vaccination to prevent cervical cancer in adolescents. So, आज हम बात कर रहे हैं यूथ अवेयरनेस हाउ टू प्रिवेंट सर्वाइकल कैंसर फॉर फ्यूचर जनरेशंस, और इसके बारे में बताने के लिए हमारे पास आई हैं डॉक्टर वीना शिंदे. Dr. Veena Shinde is a highly respected obstetrician and gynecologist with an impressive academic background that includes MBBS, MD in obstetrics and gynecology, and a DGO in obstetric and gynecology. She has pursued a postgraduate specialization in assisted reproductive technology, showcasing her dedication to advancing reproductive health. With years of experience, Dr. Shinde currently serves as a consultant at Shinde's Medicare Hospital and Spandan IVF in Mumbai, where she has been instrumental in providing top notch care to women across different stages of life. Her expertise spans maternal health, fertility treatments, and preventive gynecological care, making her a strong advocate for raising awareness about cancer prevention, especially of the cervix. Welcome, ma'am. Welcome to the show again.
A very good evening. A very good evening. Thank you very much for your very beautiful introduction.
Thank you. So, shall we start?
Yes.
Okay. So, first of all, please tell our viewers what is cervical cancer and वो इतना important क्यों है आज की डेट पे हम लोगों के लिए?
Cervical cancer is the cancer of the mouth of the uterus. What happens is that the uterus opens into the vagina through the cervix. Once you are having a relationship, marital relationship, or you are having intercourse, what happens is that the semen reaches the cervix. Multiple infections also happen in the vagina and the cervix. If you are exposed to sex at a very young age, see, in our villages, people get married at 12 years, 13 years. Although the government has raised the age of marriage to 18, still lots of girls are already having 2, 3 children by the time they are 18 years old. So, the cervical trauma that occurs is also responsible for the cervical cancer. When you are having intercourse with multiple partners, early exposure, multiple partners, poor cervical hygiene means if there is repeated infection, then what happens is that area becomes soggy and there are very high chances of getting human papilloma virus. Human papilloma virus is a virus that is associated with cervical cancer. There are different strains. There are up to 9 strains of human papilloma virus that are known. Out of which 16 and 18 strain is definitely associated with cervical cancer. What happens is once you get the infection, then gradually that virus grows if your immunity is low. Girls today are smoking. Smoking also is one of the catalyst factor in increasing the human papilloma virus infection. So be careful, girls. Prevent having intercourse at a very young age and prevent having multiple partners. Suppose you don't have multiple partners. If your partner has multiple partners, then also your chances of cervical cancer increase. Nowadays, we want both the boys and the girls to be protected, so we vaccinate both of them.
So, this HPV is the one which causes cervical cancer, but how does it
Yes.
develop over time?
See, what happens is initially you get infected, then the virus stays in the vagina, and sometimes it goes away. If your immunity is good, it may go away. If your immunity is poor, it can grow, and that growth leads to irregular cells in the cervix, and that leads to cancer.
Right.
Some of
So,
these human papilloma virus also cause warts. Not all of them cause cancer, some of them cause warts, and a test can be done. A wet pap smear is done nowadays. It is called HPV LBC, human papilloma virus, and also cytology. So, the cytology tells us whether you have any chances of cancer, and the HPV test tells us whether you are infected by HPV. And if you are infected by HPV, then you must improve your hygiene, improve your immune system, and again recheck for HPV. If HPV goes away, then get immunized immediately. See, we have been working on this HPV vaccine for a very long time. Almost since 1988, people have been working on this. It was launched in India in 1999, and since 99, the vaccine is there. Previously, there used to be advertisements on the radio, but now the government is not advertising so rigorously. It is very important to take the vaccine. You can take it from 9 years of age, and only two vaccines are required between 9 to 14 years of age. So the pediatrician only can give the vaccine when the child is not exposed to anything. The chances of getting the HPV infection are very low. So please get vaccinated soon.
right. So, like you told us certain factors like sex at an early age, smoking, different partners. Besides that, also you can tell some other things due to which
Sometimes there
people are
is
at
an
risk.
increased chance if the mother has cervical cancer. There is a 6 times increased risk of the child getting cancer. So in
Okay,
case
okay.
there is any family history, you should
Hmm.
be more careful.
So, besides this HPV vaccine, also, do we tell patients to do something so that cervical cancer does not occur?
You should improve
Screening.
your vaginal hygiene. You should also have good health. You should exercise regularly. You should have a balanced diet. You should not fall prey to diabetes and blood pressure, which is increasing in India because of poor lifestyle. Improve your lifestyle so you are less prone to get this infection.
And to prevent for the prevention, do we advise certain tests or checkups to these women?
A pap smear is done. It can be done annually if there is a high risk patient. Otherwise, it can be done once in 3 years. It is a very simple test, and people should not get scared of it. A speculum is put into the vagina to retract the vaginal walls. The cervix is visualized, and from the cervix, a small little swab is taken. It is not at all painful. You should be relaxed while performing the test. And this can be either put on a slide or it can be put in a liquid solution, and you get the report in 3 days. Nowadays, Metropolis Laboratory is also doing self pap smear because girls are a little embarrassed to do the smear at a doctor's place. You can do it on your own at home, and there is a 90% chance that if there is something wrong, it will be detected. So please do the pap smear. It is very, very important.
And it has been said that pap smear can sometimes detect problem like cancer much before it has occurred, maybe in a
Yes,
precancerous state. So
yes,
how does
yes.
that happen?
Cervical cancer in situ means before it has spread anywhere, you can detect it. Also, remember one thing, if you are bleeding, don't wait for the bleeding to stop. I had a patient who had advanced cancer who was not going to the doctor just because she was bleeding. And when I put the speculum inside, the entire cervix was eroded with cancer, and just with the fingers I could just take out a small piece and send it for testing. So that means that you should not wait for the bleeding to stop. Gynecologists are used to seeing blood, so you please go and get yourself checked up in case you are having excessive bleeding, bleeding that is not getting controlled with medicines. There could be something locally wrong. There could be a polyp, it may not be always cancer, but get treated. You should not get scared of going to the doctor. Gynecologists are very friendly and they are very, very much interested in seeing that all their women patients are fine.
Right. And besides these pap smear tests, it has also been known, that, the menses can become irregular, and sometimes a patient may have bleeding without menstrual time, even after intercourse. That also means they need to get themselves
Yes.
checked up.
Yes, if there is post-coital bleeding, it is one of the very important signs that you could be having cancer. Sometimes there could be some tear in the vagina also. It's not necessary that always post-coital bleeding is cancer, but in case it is happening frequently, get checked from your doctor. Okay, there's nothing to worry. Even if it is cancer, cancer is 100% curable if it is found in the initial stages. Don't wait for it to spread. And the treatment of cervical cancer is very good. Even if it has spread with good radiation and with good chemotherapy, the entire disease goes away. Only you have to keep getting your checkups done. That's all.
So this for HPV there is a vaccine. So how does it help to prevent cervical cancer?
There are two different types of vaccines. There's a Gardasil 9, there's a Gardasil 4, and there is a Servavac. Servavac has recently been launched by the government. It is very economical. The cost is only 2000 rupees. There are three doses to be taken, one, then after 2 months, and after 6 months. The Gardasil vaccine was launched in 1999, as I said, and that also has three doses. The Gardasil 4 costs 4000 rupees, while the Gardasil 9 costs 10,000 rupees. In the Gardasil 9, there are nine different HPV viruses that can be protected. So, if you take the vaccination, once you are not having any HPV infection, you will be protected against HPV, and it is only once to be taken. That the three doses that you are taken has to be taken only once in your life. If you are below 14 years of age, only two doses are to be taken and you will be protected for life. You don't have to repeat the vaccine. If you are by any chance HIV positive also, the schedule remains the same because these people are more prone to get the infection, or sex workers, or people with multiple partners, they should definitely take the vaccine because the vaginal health becomes better, the cervix doesn't get infected. And because see, we know we are staying in a warm country and it is a humid country, so the chances of vaginal bacteriosis or fungal infections is very high. Now if you don't know what it is, sometimes there is smelling, discharge from the vagina, there is greenish discharge from the vagina. So please go to your doctors, get yourself checked, get yourself treated, and don't let this infection remain in the vagina.
Right. So at what age should young people get this vaccine?
Between 9 to 14 is the ideal age. There are no side effects of this vaccine. It is given on the hand that any doctor can give this vaccine, and we have not seen any side effects except for little pain or redness at the site of the injection. Now it's almost 30, it's since 1925 and almost 26
26.
years now that we are giving this vaccine. It is very effective, and none of the patients who have been vaccinated has got the HPV infection in
Right.
my practice.
Same here.
Also, the vagina is healthy, and their chances of getting infection is less.
So can boys also get HPV vaccine? You were telling
Yes.
about it.
In Australia, both the girls and the boys are given HPV vaccine. In India also, we can give the boys also vaccine. See, we don't know who we will get exposed to. So it is better to, it may not be, it may be a genuine problem that somebody is there in your life and goes away, but still, why should you carry the stigma of getting a cancer which can be totally protected and prevented? Take the vaccine and be safe.
Right. And why is it important that boys should also be vaccinated? How does it help?
Suppose the girl has a multiple partner, they can get
Mm-hmm.
warts. Warts is
Mm-hmm.
a very painful condition. You have to either cauterize it, either with a electrocautery or with a frozen cautery. So it is better that the boys also get vaccinated. Also, when they have relations with a partner, that girl has more chances of getting the HPV vaccine if they are infected.
So, could you tell our viewers again some common symptoms of cervical cancer so that they can rush to the doctor?
Common symptoms are postcoital bleeding, as mentioned by Madam, vaginal infection repeatedly, and foul smelling discharge, sometimes irregular bleeding pattern, that is, you might suddenly bleed and suddenly it may stop. So, these are the common symptoms, and you should go to the doctor and you should get it checked.
Right. And why is early detection important in cervical cancer?
Early detection is important because with early detection you can get 100% cured. Only doing a loop surgery on the cervix, that is if you have CIN1, that is carcinoma in situ, you might not have to remove the entire uterus. Just doing a proper resection of the cervix is sufficient. While in case it is cancer stage 1, then you might have to remove the uterus, and along with that you might have to take out a part of the vaginal cuff. In case it has spread, then you must not get operated. Remember this. In case it has spread into the lateral walls, then you must get a radiation treatment done by which the cancer dries up, followed by a chemotherapy, so that you are totally cured. Surgery is only done in the initial stages of cancer. It cannot be done once the cancer is spread. Then you require another treatment for doing the treat doing the completion of the treatment.
And at what age should young women start getting pap smears?
Young women, as soon as they are sexually active, they should get a pap smear done.
And how often should this pap smear be done?
If the report is normal, they should do it once in 3 years. If the report is not normal, then they can do it every year.
And how does lifestyle affect the risk of cervical cancer besides
Smoke
smoking?
Smoking is known to increase the risk of cancer. A good, healthy body with a good immune system is less prone to cancer. So, my advice to women is to exercise regularly, to have a balanced diet, to drink plenty of water, to keep themselves clean, have a bath, clean the vagina, be happy, be safe, don't get into trouble. Have one
Um,
partner
yeah,
and encourage
and
your husband also to have one partner.
one partner, exactly. So one viewer is asking, you are saying about safe sexual behavior. So what exactly should we use as a contraception?
See, if you are not married, then you can use condom. Once you are married, then you can stop using the condom because your partner is fixed.
Right.
That is a barrier
And
contraceptive. So the
right.
semen will not spill into the vagina, and you have to put the condom on before you enter the vagina. So condom is a good contraceptive to prevent cervical cancer.
Right. And are there any myths which you would like to tell the viewers about cervical cancer?
See, cervical cancer is totally curable. That is very important. If you go to the doctor and you get checked, pap smear is not painful. So please get the pap smear done. It is just a swab from the cervix, a small little, you can say how you have your earbud, like that it is there, a small little swab from the cervix. It does not pain, so don't get scared. And cervical cancer is not generally because of eating anything, but it is just because of your exposure to intercourse. So please be careful, and please see, when people are drunk, they don't know what they are doing. So please be in your senses and protect yourself.
Right. So, there's a contention going on that now people are vaccinating children in school for HPV vaccine. So they feel that by giving them that vaccine, you give them knowledge about HPV and
No, no, no,
sex.
no, no, no.
So will they be more promiscuous? Will they start having sexual
Not at
activity
all.
earlier?
See, they get so many vaccines, in that they get this vaccine also. There is no need to for the children to get. They have so much of studies and they have so many activities. You should keep them busy. You should keep them away from this whole talk of sex, and exposure to these things should not be given at a young age, because then they go away from their studies. And it is very sad if we spoil the future of our young children by exposing them to all these things.
Yes, right. Another thing that they want to know is, let's forget about adolescents, but general public, how can we increase the awareness amongst them about HPV vaccine? So, if a woman is in her old age, like 40, 50, at least she will go and get it for her children or her nieces, like that.
See, what we do in Mumbai is post delivery, if the girls are not vaccinated, we vaccinate them because they come for the children's vaccination. And cervical trauma at the time of birth is there. So it is easier to motivate them to get the vaccine. And we also try and have awareness camps in the different schools around, and we tell them about hepatitis vaccine, we tell them about thyroid checkups, and we tell them about this cervical cancer vaccine. It is not necessary that the child is exposed to relations, and that is why we are telling them to take the vaccine. Some children go abroad to study, so before they go abroad, we give them the vaccine. We just want to protect our child from any type of infection. That is why we are giving the vaccine. We are not giving it to them so that they have a freedom. Okay.
Yes.
Uh, of course, our Indian values are very much imbibed in our children, and I am sure that our children are more careful, and they are more you know. They have
Aware.
more responsibility to take care of themselves.
Yes. Certain universities, you rightly said, in abroad, they ask for a certificate of HPV vaccination at the time of admission. So I find many young girls taking at that time that I have to go for admission. So please complete my vaccination. Besides others, HPV vaccine is also one of the many that they prescribe. So that is a very good way. And how many percent of cervical cancer you think gets prevented by taking this vaccine? Is it 100% or less, or what?
See,
What
in
is your
my
opinion?
career, I have seen not a single person who has taken the vaccine got cervical cancer. So I'm very satisfied with the results, and I really want all the people who are who can take the vaccine should take the vaccine. We can only take it till 45 years of age. So please take advantage of the vaccine and protect yourself.
Right.
See, we take the influenza vaccine every year,
Yes.
but this
Yes.
vaccine is only once to be taken. 3 shots and you're covered for life. So I think that is enough motivation to take the vaccine. And if they do it
Yes.
at their parents' house, it is
Hmm.
better.
Hmm.
See, up to 14 years, the girl is generally with the parents. So it is easier to protect your girl child. It is a very important gift you can give her, the gift of health. So every parent should give the girl child this gift of health so that she doesn't land up suffering in the future.
Right. Very right. Because be it cervical cancer, be it a wart, both of them are very disturbing and painful
Yes.
conditions. So, right. So, any take home message, Dr. Shinde, for our viewers?
Be happy, be healthy, and protect the
Yes.
girl child.
Yes, that's very nicely said by you. Thank you so much, Dr. Veena Shinde, for joining us today. Could you show us the certificate, please? That's a small token of our thanks for you to come and give your time and tell our viewers so many good things about HPV vaccine and cervical cancer. I think our listeners, so many questions have come which I put forward to you. So it has been a very interesting chat today. Thank you so much, Dr. Shinde, again. That will be all for today. Dr. KK Med Talks will return tomorrow at 7 p.m. with another edition of the show. Keep watching Dr. KK Med Talks. Namaskar.
Namaskar.